Good morning and welcome to Tuesday Tooth Talk. I'm Dr. Kuiper, and today we're going to talk a little bit about smoking and the effects that smoking has on your mouth. Most people know the effects that smoking has on your lungs or your heart, but they don't know that smoking also has damaging effects to your mouth, your gums, and your teeth. One of the big things we see is that as that smoke goes through your gum tissues and through on down to the lungs, it actually settles on the teeth. And the first thing you notice is you get the nicotine staining and the yellowing of the teeth. That's probably the least harmful of the effects, but it's also the one that people notice first because that nicotine does turn the teeth a very stubborn to remove yellow color. The next thing that happens is as that stuff builds up on the teeth, it actually allows harmful bacteria to get down deeper into the gum tissues and actually lead to periodontal disease, gum disease, and other issues with the support structures of the teeth. So that as you continue to smoke, your gums will actually recede, the teeth will look longer, they'll get more loose, and then as they get longer, they'll continue to yellow, and the process just kind of continues. It builds on itself. So the longer you smoke and the more you smoke, the harder the damage is to undo. The last thing that happens is smoking actually delays our healing response. So what that means is when you get a cut in your mouth, when you get a tooth pulled, if you have anything that's not absolutely perfect in your mouth and your body is trying to heal it, that will slow it to the point where it's very, very difficult to recover. So for example, if you get your wisdom teeth out and smoking afterwards, that can lead to dry socket, which for those of you who've ever had is very uncomfortable, and I highly recommend avoiding it. The other thing that it can do is for implants or other areas of the body where there's any sort of inflammation, you can actually lose an implant or lose the tooth because that smoke settles into those areas and causes that inflammation to get worse, causes pain to get worse, and delays any sort of healing. So your body doesn't have a chance to actually recover. Now, we highly recommend people to get on, Quitline or anything like that to get the help they need to quit smoking. But if you have any questions, let us know. We always try our best to be as understanding as possible with all this stuff, but we also want you to have the information you need to have a long and healthy life. So if you have any questions, please give us a call. Otherwise, enjoy the rest of your Tuesday.